Welcome back, everybody, for another deep dive. This time we are taking a look at a recent study. We're going to unpack this research and see if this new technique called erythritol air flowing, or EAF for short, really makes a difference.
Yeah, what's really interesting about this study is it goes beyond just looking at how well the treatment works clinically.
hmm
It considers the patient's experience, which is a huge part of how people feel about their treatment, right?
Yeah, absolutely. Feeling good about the treatment is so important. But before we get ahead of ourselves, let's break it down. What exactly is erythritol air flowing?
It's a pretty simple concept, actually. Um, Imagine a gentle jet of air water and a fine powder, and that's cleaning your teeth. The powder is erythritol, and it's a natural sweetener. You find it in fruits like grapes and melons. So not only does it clean effectively, but it also leaves a slightly sweet taste in your mouth.
Okay, so it's more pleasant than the scraping and discomfort of traditional scaling. But how does it fit into treating something as serious as periodontitis?
Well, EAF is a key part of guided biofilm therapy. And this is a newer, more patient-friendly approach to cleaning. And it focuses on gently removing the biofilm, that sticky layer of bacteria from your teeth.
So for this study, how did the researchers test if EAF was actually a better option for treating periodontitis?
They set up a randomized controlled trial, and that's like the gold standard for this type of research. They had 26 participants with stage 3 or 5E periodontitis, so that's pretty severe gum disease, and they randomly split them into two groups. One group received the standard subgingival instrumentation, we'll just call that SI for short, plus EAF, and the other group only received SI.
Okay, so one group got the new EAF treatment in addition to the standard cleaning, and the other got the standard cleaning on its own. How did they make sure one group didn't have an advantage going in?
They were really careful to make sure that both groups were similar in terms of age, how severe their gum disease was, and any other factors that could skew the results.
Makes sense. So we've got our two groups. What exactly were they measuring to see if EAF made a difference?
They looked at both clinical outcomes and what the patients reported about their experience. On the clinical side, they tracked things like probing pocket depths. This is basically a measure of how deep the space is between your teeth and your gums. And they also measured bleeding and plaque buildup, all pretty standard ways to evaluate gum health.
So they were getting the hard data, but what about the patient-reported experience? You mentioned that earlier, and it's not something you see in every dental study.
Right, and that's one of the things that makes this study so interesting. They used a visual analog scale to track things like pain, sensitivity,
hmm
and even bruising. They also used something called the General Oral Health Assessment Index, the GOHAI for short, which gives a broader picture of how periodontal treatment affects people's lives.
Okay, so it goes beyond just how healthy their gums are. What sort of things does that assessment look at?
So the GOHAI looks at things like how well you can chew if you have any pain, and even psychosocial factors like how self-conscious you might feel about your smile.
I can see how that would be important. It's not just about the numbers, it's also about how you feel. All right, so we've set the scene. Now, the big question. Did ESF actually deliver? Were the results worth getting excited about?
Yeah, this is where it gets interesting. Both groups saw significant improvement in their gum health after 3 and 6 months. Like probing depths decreased by an average of 1 millimeter. Bleeding scores improved by about 50%. And plaque levels went down.
Wow, those are some pretty significant improvements. But was the EAF group better?
That's the catch. There was no statistically significant difference between the two groups in terms of those clinical measures. So while everybody's gums got healthier, adding AF didn't seem to provide a clinical advantage.
So it seems like a bit of a letdown, all that technology and no measurable difference in gum health. Where does that leave us?
Don't despair just yet. Remember that patient experience piece we talked about? Well, that's where things take a turn.
Okay, I'm intrigued. Tell me the EAF group was at least happier with their treatment.
You got it. While both groups reported low pain and sensitivity levels, the EAF group showed a statistically significant improvement in the psychosocial part of the GOHAI.
Okay, break that down for me. What does that actually mean for the patient?
It's hard to say definitively from this one study, but it indicates that the people who received EAF felt better about their smiles, were less self-conscious, and just had a more positive psychological experience. That's something, right?
It definitely is. So even though EAF didn't objectively heal gums faster, it seems like it made people feel better about the process.
Exactly. And we know that feeling good about your treatment can have a huge impact on whether you'll, keep up with future treatment, which then leads to better oral health in the long run.
That makes a lot of sense. I know I'd rather have a more pleasant experience, even if the end results are similar.
Wouldn't you? And this isn't just a random finding. Other research backs up the idea that EAF has a positive impact on how patients feel about their treatment.
Okay, but let's be realistic for a minute. This was just one study, and it had a fairly small sample size. Can we really draw any solid conclusions from this?
Yeah, you're right. It is important to remember this is just one study. But even if it's not, the be-all, end-all, it does bring up some interesting questions about how we think about these kinds of treatments.
Exactly. Do we only focus on the clinical outcomes? Or should we also be thinking about the patient's experience and how they feel, those psychosocial factors you mentioned earlier?
Yeah, it's something we should be thinking about more. For a long time, healthcare has focused so heavily on the numbers, things like blood pressure and cholesterol levels. But how people feel during and after their treatment really matters too. Their comfort level, their confidence, all of that contributes to their overall well-being.
Yeah, this study really highlights that those more subjective experiences can be just as important as the objective data. EAF might not make your gums heal any faster. But if it makes the treatment more tolerable and maybe even enjoyable, wouldn't you be more likely to go to the dentist and stick with your treatment plan in the long run? I know I would.
That's the idea. Anything that gets people more engaged in their oral health is a good thing. We know that gum disease is linked to other health issues like heart disease and diabetes. So if you can improve your oral health, you're improving your overall health as well.
Yeah, it's all connected. That's what makes these deep dives so interesting. You never know where they're going to lead.
There's always something new to learn. Um, let's say further research confirms what we've seen in this study. What do you think the implications would be for dentistry?
Okay, let's imagine for a minute that EAF does consistently lead to a better experience for the patient. Would it become the standard of care? Would it be the go-to option for everybody?
I'm not sure it's as simple as that. Cost is always a factor. EAF requires special equipment and materials, which could make it more expensive.
And of course, not every dentist would have access to that equipment. But let's assume those barriers could be overcome. Do you think it would completely replace traditional methods?
I don't think so. It's more likely that it would become another option, another tool that dentists can use depending on the patient's needs and preferences.
Yeah, it would be about giving people choices and making sure the treatment is as comfortable as possible.
I like that. Dentistry shouldn't be about, just enduring pain. It should be about helping people get healthy and happy smiles.
Absolutely. And this kind of research could even inspire other innovations in the field. Maybe we'll see even more patient-centered technologies and techniques being developed.
That would be amazing. So what would you say is the main takeaway for our listener today? What should they be thinking about after this deep dive? I think the most important message is to be proactive about your health. Don't be afraid to ask your dentist about new technologies and techniques like EAF. Do your own research. Stay informed.
Knowledge is power, as they say, especially when it comes to your health.
And remember, it's not just about what the clinical data says. It's also about how you feel. If you're not comfortable with a treatment, speak up. There might be a better option out there for you.
Yeah, I think we've given our listener a lot to think about today.
I think so too.
But before we wrap up this deep dive, I've got one last question for you. Has this study changed how you think about dental treatment? Would you be more likely to ask your dentist about EAF?
It's definitely given me a new perspective. I've always been more focused on the clinical side of things, but now I'm thinking more about the patient's experience.
Me too.
Hmm.
It's encouraging to know that there are options out there that prioritize patient comfort. It makes me a lot less apprehensive about going to the dentist.
That's a win for everyone.
Well said. It seems like we've reached a natural conclusion point for our deep dive today.
I agree. It's been a fascinating conversation.
So for our listener out there, if you're looking to learn more about EAF and guided biofilm therapy, where should you go?
You can find a lot of information online. The websites of dental associations like the American Dental Association are a good place to start, and many dentists who offer EAF have information on their websites as well.
And of course, don't hesitate to talk to your dentist. They can give you personalized advice and help you figure out the best treatment options for your needs.
Exactly.
Well, I think that wraps it up for us. We started by looking at one research study and ended up having a much broader conversation about patient-centered care, the importance of staying informed, and the future of dentistry.
It really shows how much there is to learn, even from something as seemingly simple as a dental cleaning.
It's been an interesting journey, for sure.
I've enjoyed it.
And for you listening out there, we hope you've enjoyed it too. We'll leave you to ponder all the possibilities.
Until next time.
It's amazing how one study can lead to so many, bigger questions, isn't it? Maybe this deep dive will even inspire someone listening to explore this topic further, become a dentist, or even invent a new dental technology. You just never know.
Yeah, you're absolutely right. The possibilities really are endless. And that's what's so great about knowledge. It sparks curiosity, leads to innovation, and ultimately helps us all move forward.
Well said. So, on that note, we'll leave you to ponder all the possibilities. Until next time, keep diving deep, stay curious, and never stop exploring.
Farewell.